Good morning, my name is Tina Hatchett, and thank you all for coming to hear about my project proposal for the lowering the nurse-patient ratio to increase patient satisfaction scores. Happy, happy, happy. The purpose of my proposal was the nursing shortage has created a frustration time for the healthcare workers, causing increased shortages on the units, staff turnovers, nursing burnouts, and all-around employee dissatisfaction. Employees who are emotional distress or have conflict with their jobs often have poor attitudes, and it shows in their appearance and their work. And they often spill over into the patient care realm. This is sometimes referred to as nursing burnout or compassion fatigue. With over 48% of the nurses at bedside over the age of 55, the shortage will take another hit in the years to come. How can we lessen these effects on nurses? People leave their job if they feel no loyalty without regards to the other staff members. They often lay out of work, call-ins, they have workers' comp claims. There's several different things that physical and emotional distress that are up here with these people, and they just do not become loyal to their company. My objectives were to reduce the staff turnovers, reduce staffing ratios, increasing the burnout awareness, increase employee satisfaction will increase the patient satisfaction scores. The ultimate goal for this was to have engaged employees to lessen the effects of the nursing shortage on the current nursing staff. The nursing shortage is being blamed for a number of things. The aging baby boomers, most bedside nurses are over the age of 55, nurses moving into nurse practitioner roles and also management positions, decrease in the number of new grads due to the decrease in facilities and the actual schools taking on new students because of decrease in their clinical sites and also their clinical preceptors. Not only does the nursing shortage present problems, but patients in the hospital have higher acuity and the elderly population requiring more attention with daily activities. Research has established guidelines for staff to patient ratios, but most have not looked into the higher acuity of the patients or the aging population of the patients. In order to reduce the nursing burnout and turnovers within a facility, it is imperative to look at the cost-effective ways to reduce the amount of stress placed on each nurse to avoid additional shortages. What is my question? How would adjusting patient to staff ratios in acute care facilities decrease nursing burnout, decrease the nursing turnovers, and increase overall employee satisfaction compared to the current retention strategies? Studies show that 46% of activities related Studies show that 48% of the activities in a daily 12-hour shift are related to activities like taking to the bathroom, walking up and down the halls, taking ice, daily baths, those kinds of things. And only 19% of the percentage of the time that a nurse is in the patient's room is giving out meds, doing dressing changes, IV administrations, those kinds of things. When we were looking into the research for retention, nurse-patient ratios was proven to be in the top 5 reasons why nurses leave. Federal regulations state that in order for hospitals to participate in Medicare and Medicaid, they must have the appropriate number of RNs, LPNs, and PCTs. Only 14 states are currently working to address these regulations, and Georgia is not one of those. This is just a diagram of what California nurse-patient ratios look like. For the operating room, it's 1-to-1. For intensive care, it's 1 to 2. Neonatal care, it's 1 to 2. Emergency room would be 1 to 3. Step down is 1 to 3. A tele observation area is 1 to 3. Medical floor is 1 to 4. And surgical unit is 1 to 3 as well. Research shows that reducing the nurse-patient ratios improves results, improves patient satisfaction, lowers readmissions, and decreases acute care mortality. This is also proven to improve employee satisfactions and results in more staff engagement and quality improvements within the hospital. There are 4 basic things affected when the workforce planning. You have budgeting, the fiscal year estimation of the year the nurse's needs. You have rescheduling, revision due to staffing needs and patient census, scheduling, which is your basic 6-week nurse schedule, and also your daily assignments, which normally happen by your primary caregiver assigned to a group of patients that's usually 30 minutes prior to your shift. The current ratios for nurse-patient in the state of Georgia are 1 to 6 for a medical surge unit. This is without regards to patient acuity or daily activities needed for the patient. During a study that was performed by Sir, Baker, and Steege, there was a performance evaluation of a 29-bed unit that on a 12-hour shift that showed that was mostly the capacity of this unit was 95% full at all times, showed that 46% of the activities done on a daily basis for one nurse for 12 hours was daily activities as far as bathing, taking ice, food trays, feeding, changing linens, and also assisting to the bathroom. Only 19% of that was medication, IV administration, changing wounds, or any daily therapy needed. So to decrease the nurse-patient ratio has proven to reduce stress. Reducing stress prevents nursing burnout. Stress can affect someone not only emotionally but physically and increase on-job injuries and decrease work performance. This is just an acuity-based staffing graph that just shows what you can look forward to for complicated procedures. It kind of levels out what your procedures are. If the patient is on 1 or more drips, if they have tele, if they have wound changes, if they are complete care or semi-care, if they need 1 assistant to the bathroom, 2 assistants to the bathroom. It takes all those into consideration for the amount of activities that would be needed in order for the patient for the nurse to take care of that patient on a daily basis. To evaluate this project, you have to look into another solution. In order to evaluate this proposal would be over a 3-month period and based on satisfaction scores, employee surveys, employee referrals. The recommendations would be to reduce the nurse-patient ratios, engagement activities for staffing growth, activity-based staffing, provide additional resources such as LPNs, PCTs, which is our patient care technicians, or EMTs that could cross-train to help as well. Also cross-train some of your staff to work in the critical care areas such as the ER or ICU, working with paramedics, or cross-train staff so that if your needs are higher in ICU, you can float nurses from the ER up there as needed. The expected outcome of my proposal would be a reduction in turnovers and nursing burnouts. To evaluate the success of this project would be to review the compliance of the project over a 3-month period, and also to review the increase in patient satisfaction scores. To conclude this project, to determine the overall success of this project would be to have an employees proud to work at the facility and for them to refer others to work there as well, and not just for a referral bonus. The nursing shortage is not going to resolve anytime soon, and working to reduce the stressors is essential to remain in the top competitive healthcare market. I would like to thank you for your time, and thank you for everyone coming today. I really appreciate your time before I had to do this interview. Thank you again.